Welcome to ABP Desam Health Conclave 2025.
The topic stands from screening to care to creating an inclusive renal network. Let's invite the moderator for this topic, Vidhi Maheshwari, to the stage, and let's give it up for the speaker joining us. Put your hands together for Mr. Subodh Gupta, Director of Renalyx Health Systems Pvt Ltd. Let's welcome sir with a huge round of applause, please. Thank you so much, sir, for joining us. Over to you, Vidhi. Let's take this forward.
Thank you so much, Mr. Subodh Gupta, for joining us. Now, Renalyx is on a mission to make dialysis treatment more affordable, more accessible for the country. So let's talk about that. How are you doing, by the way? Thank you for being very patient.
Thank you, Vidhi. And first of all, let me thank you and the ABP network for inviting us here and, discussing about creating a network which provides a continuous support to patients suffering from the CKD.
Yeah, so chronic kidney disease is a major concern in India.
Right.
And the affordability or accessibility to care is very limited. Why is that?
What I understand the major reason for it is, the distance of the dialysis center to the patient's home and the access to dialysis for these kind of patients. You'll be surprised to know there are around 20 million patients in India who require dialysis. And with our current infrastructure, we are able to provide regular dialysis to only 25 lakh patients.
Oh.
So that means there is a huge need huge gap. And if we talk in terms of number of machines, so currently in India, we have around 54,000 operating dialysis machines, all companies put together, while the need is around 2.5 lakh dialysis machines, given the number of patients we have. So that's the gap which we have today. One of the reasons for this, which I understand, is our dependence on imported, machines.
Machinery.
So today is primarily some foreign companies which are primarily supplying the dialysis machines to the country. So that could be a reason for this gap.
So Renalyx has identified this gap. And how are you working on closing this gap? The mission that you have, the Made in India machine that you're working on. Let's talk about that.
Right. Thank you, Vidhi. So we are the, we are the company as Renalyx. We have developed the first indigenous machine. When I say indigenous, it is not a, it's not a knockdown model or an assembled model. This machine has been developed in India by our scientists from scratch. So you can proudly call it's the first Indian dialysis machine.
All right. And how do you plan to make it accessible to the population that you've mentioned, who's losing out on the proper care?
Right. So it's very important that this benefit reaches out to the patient who require this. And that's where we are working with a lot of state governments, the central government, the NGOs. And our mission is to bring dialysis closer to the patient. See, a lot of patients do, drop out of the dialysis in the first year itself. The reason being the travel time which is required to reach a dialysis center. Today, there are a lot of governments who are supporting in terms of giving a free dialysis session to the patient. But unfortunately, because of this logistic issue, there are still a lot of dropout seen. So we want to bring dialysis closer to the patient.
And what percentage of the machine components are sourced locally? Like you said, this is absolutely made in India.
It's more than 80%. It's more than 80%. And the rest of the 20%, which are critical components like some pumps, we are also working on it. And by the end of this year, we'll be able to do 100% indigenization of the machine.
So I was reading that dialysis in India is far cheaper than what it is globally.
Right.
But it is still, affordability is still an issue in our country.
Right.
So apart from accessibility, how are you going to help make this care more affordable?
So if you look at, the number terms, one dialysis procedure in India is close to $80 as compared to $250 to $300 globally. And most of this, for the patients who fall under the BPL category, is taken care by the government. Yes, and either it is under PMNDP or various state health program like the Arogyashri here. However, since there are a lot of patients who do not fall into this category and they have to be out of pocket, and they have to take 3 sessions in a week, which is 12 sessions in a month, which is quite a huge financial burden on a middle class or a lower middle class population. So what we are trying to do is we are trying to work with NGOs, we are trying to work with various government authorities. We are trying to place, our machines where we can cut down the cost of dialysis. Another part which I discussed about was the logistical part where the patient has to spend the entire day and money to travel to the dialysis center. So if I bring it closer to his home, then probably that cost also we can come down.
What you're working on, what your plans are absolutely fantastic, and they'll help so many Indians who are suffering from chronic kidney diseases.
Thank you.
Are there also plans of working with insurance companies to help make this a little more affordable? Because the issue is accessibility and affordability both.
Right. So, we are working with insurance companies. We are, working with them in order to make them understand that, dialysis is a requirement without which a patient of CKD who is into stage 5 CKD, stage 5 CKD cannot survive. So we need their support. Insurance companies have been supporting, and we are working with them to bring the cost down in terms of, bringing the premiums down to help them understand that this is a need which is, a very basic need of a person who is suffering from CKD.
And despite such huge numbers, we've got 20 million people suffering from chronic kidney diseases. There was never a made-in-India machine before.
Right.
So why was there a challenge, and what were the challenges that you faced when you came up with India's first Indian country-made machine?
Right. So surprisingly, you'll be surprised that we as a country have advanced a lot in other technologies, like it may be a software or an AI or even defense technologies. But somehow as a country, we are lacking in the medtech area. So we realized this, our founders realized this, and we started working on these projects around 11 years back. It's a complex machine because you have to take the blood out of the patient's body, purify the blood, and put it back into the patient's body. So it's a complex machine. The technology was not so easy. But we have been able to do it, and you will be glad to know that our machine has been certified by the European authority. So it is a CE certified machine. So it is as good as any other machine globally available.
That's great. And it is now available in India?
Yes, it is available. We have got the production license. So in next couple of months, we are going into production, and it will be commercially available in India.
Oh, that's wonderful. Hopefully a lot of Indians will be helped with this. I would also want to know, what message would you share with healthcare professionals, especially patients, stakeholders? Because when you implemented and you created this machine, there were challenges that you faced. There were learnings that the company and your founders had. So what is the message that you'd like to convey?
So we as an organization not only work on dialysis as a process, we also help in a primary screening of CKD patients. CKD is one disease which progresses very quickly. So we want the screening to happen at a grassroots level, for which we have an app where with a very simple test, a patient can be identified whether he's a CKD patient. So if we know that at a very early stage the patient is suffering from CKD, then early intervention can delay the progression of disease. Number 2, we are working with healthcare professionals, and my request to all the healthcare professionals, the nephrologists who request for their support for this machine. This is a global product. It's a world-class product. And you'd be surprised to know, Vidhi, that we have got thousands of inquiries from countries outside India, and those companies and those service providers are very, very interested in this machine because it has got some very unique features. It's a world's first smart AI dialysis machine, where the monitoring can be done remotely. Today we have around 3,300 nephrologists in our country, but they are mostly based in metro cities. And, it's very difficult for them to monitor a dialysis which is happening in a remote town. But with Renalyx system, they can monitor the dialysis on a real-time basis, sitting anywhere in the world. If there is an issue, they can do an intervention right from there, help the dialysis technician So there are a lot of very innovative features which come along with the Renalyx system, which are not available with any machine globally as on today.
Like you said, you started on this project 11 years ago, and there's clearly a lot of hard work, a lot of learnings that have gone in, and I think you'll be able to help a lot of Indians. You'll be able to help a lot of people, actually, not just in India and globally. Is there a message that you'd like to give? We've spoken about the stakeholders and medical professionals, to the people as well, because renal care, like you said, screening is something that people probably miss out on. A message on taking care of their own renal health.
Right. So, although I'm not a doctor, but we all know that CKD happens primarily because of uncontrolled hypertension and uncontrolled diabetes. That is where the kidneys get impacted.
Okay.
And there is a huge population in our country who suffers from both these diseases. So the best is to improve your lifestyle, work on a healthy lifestyle, and if at all you get a hypertension or a diabetes, ensure that it is under control. So if it goes uncontrolled, then it leads into a chronic kidney disease or a ESRD.
Perfect. Thank you so much for talking to us, Mr. Subodh. We've learned a lot about the machine. I wish you all the luck, and I hope more and more Indians have access to this. Thank you so much for making this renal care, chronic kidney disease to be much more affordable, much more accessible. Thank you so much for your time.
Thank you, Vidhi, for giving us this platform to talk about.
Thank you.
Thank you so much.
Thank you so much, Vidhi, and thank you so much, sir. I would request Mr. Nageshwar Rao to please join us on the stage as we felicitate sir today here with us. Thank you once again, Mr. Subodh, for your insights, and thank you for being and doing the work you've been doing for improving. Shake. So yes, we've heard about the dialysis treatment, how it goes. Thank you, Vidhi, for taking this forward.